Okay, this is Pressure Ulcers with, I'm Suzanne.
I'm Kaylee.
I'm Mary.
I'm Kajal.
I'm Sydney.
Here we go.
Here we go.
Let's take off.
Okay, overview of quality safety measurements. What is a quality dashboard? Quality dashboard is data collection and used for healthcare analytics that help improve care and further insight into poor quality and insufficiencies. Um, what is a quality indicator? An indicator is an evidence-based information including the process and outcomes and what could be changed. And our indicator is pressure ulcers. How is a dashboard used in nursing at the organizational level and at the unit level? Um, Dashboards in nursing at both levels, I guess, are used to compare data and from smaller to larger scale. And how is data collected? Data is collected from multiple sources, including can be different departments, hospitals, state, and USA nationally wide. And it's kept in multiple formats, and it can be edited and revised.
So the quality indicator for our example of the pressure ulcers, each quarter they wanted to have 0 pressure ulcers, which can be seen as the target of 0. The actual in the first quarter was 4 pressure ulcers. In the second quarter it was 5. In the third quarter it was 3, and in the last fourth quarter it was 4 pressure ulcers. So that led to the negative variances.
Why are we measuring this indicator? We are measuring this indicator because healthcare workers an amount of time in preventing these pressure ulcers by repositioning the patient, giving some extra measures. However, there has been increase in 61% over the course of 11 years from 1993 to 2004. We can say that from WCET, which is the World Council of Enterostomal Therapists, that pressure ulcers was reported in have 280,000 in hospitalized patients, and 11 years later it increases to 455,000. This shows that even after implementing measures, the amount is still increasing. We can talk about how CMS measures is an issue for the reimbursement because CMS they have divided the categories into 3 parts. The group 1 devices are those who have static. It includes air devices and water overlays or on mattresses. The group 2 devices are powered by electricity and are considered dynamic in nature. These devices includes alternative and low air mattresses. These are good for the patients who are at moderate or high risk of pressure ulcers, but not those who have full thickness loss of their skin. Finally, the group 3 is also the dynamic, but it also have air fluidized beds. These beds are electric and it contain silicone coated beads. It works when the air is pumped through the bed, the beads behave as a liquid, and this might keep the patient skin moisture, which can act as preventing, but also it keeps the skin moist and there are high chances of pressure ulcers with that.
So these things are kind of issues because most insurances don't reimburse for pressure ulcers and hospital stays. So that's kind of why that's an issue. It also takes up a lot of time with nurses having to reposition patients if they can't reposition themselves and stuff like that. So
now we're on slide 5.
Okay.
Addressing
Sorry
the
for
deficit.
that little
Sorry,
mix-up.
it won't let us go back.
Yeah, I'll talk about my article first. That's
Yeah.
fine. Okay. The article that I had was called "The Role of Nutrition in Pressure Ulcer Management." Nutrition and hydration are important in maintaining the integrity of the skin and tissue, as well as supporting wound healing. So, just to like talk about diet for like improving skin integrity and preventing. Protein is required for cell growth, so you want to include that in your diet for sure, especially in older adults. And having enough fluid is good because ensures adequate blood circulation and skin rigidity. So your skin is more likely to heal sooner, if you're not like dehydrated or something like that. And then iron promotes collagen formation, and that helps improve circulation to the damaged tissue area. So a lot of people have iron deficiency, especially in older adults. So even if you're not getting enough iron in your diet, they recommend taking like an iron supplement or something like that. So diet is definitely important when it comes to skin, and then the wound care of that is just pretty much the summary of that article.
Perfect. So then going ahead and then just talking about my article, which is the incidence of risk factors of pressure ulcers among general and surgical patients. Basically, this article just explains that pressure ulcers is one of the main post-operative complications, just because they're going to be lying in bed for an amount of time in pain. A lot of people don't want to move them because either they can't or they have to be stationed in one position for a while. So this ulcer will result in impaired tissue and the loss of the part of the body cells that will progressively ruin the lower layers. So it's important as nurses to be able to use the Braden scale. It's also important for us to like predict pressure ulcers risk so that we can all work together for these surgical output patients to try to minimize the risk factors of it, because it says 34 out of 191 patients will have pressure ulcers. So we need to see the signs and symptoms before they occur.
Okay, my article was kind of on, I guess if you already have the pressure ulcer, it was called use of dermal gel pads, and well, it says preventing and managing pressure ulcers, but for the most part, managing. So for the fact of those who already do have pressure ulcers, and mostly on bony prominence, they were talking about how to apply the gel pads and the fact that they can lessen the time of the pressure ulcer and management of it versus letting it get to a stage where you couldn't even use the gel pad. Also with the fact of using other types of creams, mattresses, and other variations. Really, the gel pad is, I guess, a method that it was studied to see what the effects were on it, and overall it had a good effect on helping it significantly. So it was just basically on managing with the gel pads.
My article had to do with ICU patients and preventing facial, tongue, and oral pressure injuries. I think that's something we don't usually think about when we think about pressure ulcers. We think about them being on the behind area and like on your heels and stuff like that. But my article said that pretty much the best practice for preventing these facial, tongue, and oral pressure injuries was to use the non-invasive ventilation masks, protective dressings, including hydrocolloid and the transparent film dressings, the silicone pressure reducing strips or pads like Suzanne talked about, and then repositioning. And it said for ICU patients the best practice was repositioning every 72 hours, which I don't know why it's every 72 hours. Seems like a long time for me. So I'm not really sure why it says that is the best practice. It does not give a reasoning for that, but I think that was kind of interesting. And it also said in the conclusion of my article that there is not a lot of evidence regarding ICU patients and how to prevent their pressure ulcers. So there probably should be more studies about that.
Okay. My article was getting serious about preventing heel pressure ulcers in hospitals. The common things about these all articles is by preventing them, we have to use repositioning the patient every 2 hours. but in some patients who are critically ill, they can go for 1 hour or more than 2 hours based on their diagnosis and their situation. The other things that we can use is a heel protection device. It can prevent the skin from breaking down by covering an outermost layer around your skin. Nutrition, skin care to assess for the blanching or non-blanching response to the heels on a daily basis. It is not always possible to see maybe a red color pigmented skin in dark color patients. That makes them at risk for having pressure ulcers more. We can use support surfaces such for pressure redistribution and mechanical loading when you are moving a patient who is maybe obese or is an immobile patient who cannot move or who is very unstable to even move. So I think that's all.
For the next slide, it says discuss the role of the BSN prepared nurse in facilitating this change with some recommendations on how change could occur. So the RN's role in this is to enhance patient safety and the quality effectiveness of care. Pretty much as a BSN RN, we have to facilitate change in whatever, if we are in a management position, how we see would be fit. So that does include doing research on things like we are now, and researching best practice for things, and then just finding out various ways of treating that aren't maybe commonly used. They might already be commonly used, kind of like how we know to reposition patients every 2 hours helps to prevent, but in some cases you can't do that, so you might have to go on to something else to try and figure out how to prevent a pressure ulcer. The role of the RN in monitoring the impact of change, pretty much as a BSN RN, we are kind of leaders on the floor and in our practice, and so we have to be able to kind of decipher what we've done in the past that has worked, what hasn't worked very well, and just kind of see, what could be best. And then once we figure out something that, hey, this works on 95% of the patients to be able to prevent pressure ulcers, that can then be presented to someone who's higher than us and kind of get it implemented into the entire system. So that's how we would use the technology and data collection, because when you're collecting data, it's got to be collected properly in the scientific method and things like that. So that's kind of how we go about doing that.
Okay, so for informatics in nursing, discussing the roles of informatics and the implications of patient treatment outcomes. So as technology advances, healthcare organizations are able to collect and analyze more data efficiently. This will change how implementations of healthcare rules will change, and we will also find better routes and advantages to take care of patients. So how can informatics be used? Informatics can be used in mobile health devices and to help patients monitoring. This can also be like telehealth, monitoring over screens, and wearable devices.
Okay. On how data mining is relevant to this topic, the objective is to use the data mining techniques to construct the prediction model for pressure ulcers. So you want to have data mining so you can learn like what works for preventing pressure ulcers, what prevents pressure, or what causes them and what's preventing them. And having all that information, like you can measure the sensitivity, the specificity, and G-means, so you can put that together on a pressure ulcer data set.
Yeah.
In our scenario, like what recommendations for the use of informatics you would make, definitely just keeping like a record, definitely using data mining to know like what's working and what's not.
Just having the system available to look and see what's currently changing.
And make sure everybody's like accurately charting, and stuff like that.
The old Braden scale.
Yeah, old Braden scale. How's that?
Summary of main points. what is the role of performance measures? That would just be looking at the overall performance measurements and seeing what worked, what didn't work, what's changed, and what you can do for the future. Why is observing for performance deficit important?
That could be used too, like if a certain patient is prone to pressure ulcers and you know that and they've been in the hospital before, that can just be seen as, maybe they didn't get enough protein in their diet their last day, so that could have been a cause because everything else was done by best practice. So it could be something as simple as looking at their data and just seeing what could possibly be changed. That could go for any patient too, across the board. If you're seeing a trend that most patients aren't getting enough protein in their diet, that could be an added thing that you could look into, adding protein or adding iron pill to everybody's orders, unless it's contraindicated.
How could using best practices improve the deficit? I feel like we've already kind of said that. Just keep up with the information, the research, then of what does and doesn't work. What is the financial implication for hospitals? I guess that being said, if you can first of all prevent the pressure ulcers, that's going to be less cost. But also then to see too, then if there are pressure ulcers, what's the best methods at the lowest cost, but for the greatest impact. Yeah, pretty much. Yeah.
No, that's a good.
Yeah.
According to the article that I had, the length of the stay and the amount in pressure ulcers, it leads up to $43,000. So I would say preventing them would not decrease that instantly, but these measures can help. Yeah, they can help maintain. That's all. Thank you.
Here are references.
Reference page.
Thank you.
Thanks.